asking to change is the policy structure and clarification, the eligibility of SEND nursery age removal, compulsory school age clarify and the change the assessment of school spaces, eligibility for post 16, I've got to get a drink, statutory walking distance on walking route, transport that is not a bus pass or direct travel, excuse me a moment. The Department of Transport has classified alternative assistance, reduced description in policy as it is not a statutory requirement.
Are there any comments from other Cabinet members?
Yeah, I guess I'll put some up. So the policy is being changed for several reasons. To update the policy to better reflect the changes that the Department for Education made to its statutory guidance in 2024, so it brings us in line with that. To revise non-statutory duties, the proposed changes will update the policy in line with recent changes in the statutory guidance, revise non-statutory duties, ensure consistency across the county, simplify the application and assessment process, and ensure the walking routes assessment is in line with national guidance and implemented effectively.
My second question was about, you say a compulsory school-aged children. Can I just clarify, is that from 5 years? And what is going to happen to 4-year-olds in reception? Because obviously children start school after they turn 4. So are we saying that there might be children that don't get transport provision in reception until they turn 5?
Not applying that to SEND children, we're just applying it across the board that nursery children will not have home to school transport under nursery age.
I was talking about children in reception, but anyway. So do we have the numbers of the table that actually the policy will affect? Because I don't know if those numbers of children are in there.
With the figures, we can work with officers afterwards and make sure that we get that nailed down. Are there any more questions?
Can I just finish up? Because I think if you're going out to consultation, people need to know what they're being consulted on. So all I'm saying is, if you're going out to consultation with this as it is, you're not clear about it, how's anyone else going to be clear about it? So we need to be clear what we're consulting on.
Work is led by the Safety Warwickshire Partnership Board, which brings together senior leaders from across the county, including police, district and borough, the Police Crime Commissioner, probation, health service and the voluntary and community sector. It sets out how all of these partners, organisations will work together to tackle shared community safety and priorities. In particular, it is a practical framework that supports joint working. It also creates space for new programmes and projects, such as the proposal of Warwickshire County Council Crime Awareness and Prevention Programme, and shows all accountability and comments to keep communities safe.
Thank you, Councillor Bridgewater. Councillor Jones. Just to clarify, it's page 123 for everyone there.
Thank you very much. Notice that you've got the current contract value and anticipated future contract value. Now, I understand that the council is, of course, going through extreme financial difficulties at the moment, none of which necessarily specifically a result of this administration, and not even necessarily the result of the previous administration either. It is the situation that we're in.
So I put in there, I think you're wrong there, Sam, about the financial situation. The council's not in a massive struggle at all. Everyone's having a bit of difficulties here and there, but it's not a massive struggle. I think we're pretty good compared to the other councils at this moment in time. Thank you.
My question was around whether or not the amount of future funding, which is going to be the same as the current contract value, considering we've obviously gone through a period of quite significant inflation over the last several years, and costs of services are increasing. Are we expecting to receive the same level of service for that same amount of money?
Because we're cutting out the middleman, so to speak, which is why we're able to make savings instead of through everyone help, which we were before. So that's where a saving can be made. And also it should be a lot more efficient, because the NHS have full access to the patient records